Welcome back to GTU, the first clinic of its kind in the Intermountain West that is designed specifically to support Spanish-speaking patients undergoing kidney transplants is now open.
Now joining us in the sponsored interview is Dr. Alan Contreras, a transplant surgeon for Intermountain Health's abdominal transplant program at Intermountain Medical Center, and Luis Campos, a liver and kidney transplant recipient. Welcome to the both of you.
Thank you for having us.
How are you feeling, first of all, Luis?
Well, I am feeling so good after 1 year and 3 months or 4 months. Yeah, I'm feeling so good. And the doctors been great, the nurses and the aides, oh my God, they've been doing so good to me. And I was so scared before, but now that I have this experience, I am open to anything, you know, yeah.
That says so much, and undergoing a liver and kidney, that double transplant, and look how healthy and how wonderful you look.
Oh yeah,
I want to hear.
I feel good.
You feel great.
Yeah.
I want to hear more about that, but doctor, jump in and tell us all about the new clinic, when it opened and why.
So this has been a wonderful experience. We saw the need when we were looking after some patients coming to the clinic, and then we understood that we have hundreds of thousands of Spanish-speaking people in this area to serve. So that's when the idea came from, and we decided to implement a specific time from us to get closer to this population of patients.
Dr. Contreras, can you understand, though, that bridging this gap with the Latino community and being able to have life-saving measures, would Luis be able to do this, or are we reaching more people?
So it's a great question. So when we see what is to navigate the system in health is so difficult, right? And this is going beyond providing translation services. We do have that at Intermountain. This is just trying to get closer to our population. Our motto is to bring people to the healthiest life possible. And the way to do it is to provide this access to all of them. So we are thinking to expand, of course, and this has been very successful, and we're already thinking in how can we provide these services to even more people.
And doctor, you say this is rare to have a program like this in the United States, and of course reaching those patients, they're more likely to go ahead and have a procedure that they really need when it's in their native tongue.
That's correct. We're the first Hispanic clinic for this service in the West. As I said before, this is something that we have to provide to our patients, because being sick is hard, and just trying to understand what are the specific barriers to have good access of care is part of our job. So we have to provide this good service and get close to our patients so we can give them the best opportunity they can have.
Luis, how grateful are you to have a clinic like this?
You know, one thing, before I got this surgery, I was so nervous because first, I don't speak that good English, and also it's a lot of people that you think like the minority, how do you say? La minoría?
The minority.
They don't gonna treat you really good, but when I got there first, the experience that was so good because everyone have treat me really good. So when you are Latino, you think they are gonna treat you bad, you know, but no, it's totally different. You know, they treat you like a really person, like a human being. And in the beginning, I was nervous, but when I talked with Dr. Contreras, after I have the problem with my kidneys and my liver, I feel so good because he gives me so much security, a lot. So I say, well, okay, I am in your hands, and whatever happens, that happens, you know. And I feel so good. After the surgery, I feel like my stomach was so bad and things like that. But they've been checking after the surgery. They check every week. Every week they stay there.
You're taken care of.
Yeah, they take care of me. And after 3 months, wow, labs every month. And I feel safe. I feel safe, and I feel so they give me my life back, you know.
What would you say to somebody who is in the position you were before your surgery, feeling nervous, feeling scared? What would you say to them to come in, make that appointment?
Don't be scared, you know. The people, they are so good, so nice, and just go. And now we have clinic in Spanish. Before we didn't have. So a lot of people, they are scared, but now we have the clinic, so be free to go, and they will take care of them. Yeah.
This is exactly why this clinic was needed, and that is sad to think that patients come in thinking they might not be treated well because they are a minority. Thank you, doctor, so much
Thank
for
you.
being here. Thank you, Luis.
Thank you so
both.
much.
So glad that you're in great health.
Yeah,
Thank you.
you.
Thank you again to Intermountain Health for sponsoring that interview.